Hi, welcome to Health and Wellness. I'm Erica Brooke, and today I'll be interviewing Dr. Katie Disantis, Assistant Professor of Community and Global Public Health here at Arcadia University. Welcome, Katie.
Thank you.
Good morning, and I'm glad that you're here to speak with us today. We're going to be speaking on the topic of childhood obesity today. So my first question is basically just a general overview of childhood obesity. So basically, in your opinion, what constitutes childhood obesity?
So in the U.S., we're basing childhood obesity on our height and weight measurements that we take of our children. So when you go to the doctors and they have that well visit and they're measuring height and weight, they might report to you a BMI percentile. BMI stands for body mass index, and it's a way that we look at weight related to your child's height. And they might tell you the percentile for your child's BMI. And similar to tests that we've had, standardized tests in school, the percentile is just telling you where your child is in terms of height and weight, in terms of the rest of the population. And health experts have decided on definitions of obesity and overweight in childhood based on where they see percentiles leading to health consequences. So for childhood overweight, the definition is a child who has a BMI percentile between 85, the 85th percentile, and below the 95th. And for obesity, for children, it's any child falling at the 95th percentile or above. So the definitions are based on that population level information and what we're actually measuring your child's height and weight at. And it's an indicator for overweight that it's time to start thinking about the health consequences of that and making changes. And if a child's obese, there might already be consequences that the child's experiencing. So we're most concerned about children who are actually actually defined as obese, but there's also concerns for that overweight group.
I see. Okay. So that kind of leads me into my second question, which was, what are some of those consequences and why is this such a major medical issue today?
It's a major medical issue because of the numbers that we're seeing in overweight and the overall trend. So since 1975, we've seen great increases in overweight and obesity across the population, including our children. Luckily, in the past few years, we've seen a stabilization, so that's encouraging, but we want to see the rates to not only stabilize, but start to go down. And what we've seen as more and more children are becoming overweight or obese at younger ages is that there are short-term health consequences, including what we see in adults with overweight and obesity. So we're seeing cases of type 2 diabetes, which we would not expect to see in children previously occurring at higher rates. We see even increases in cholesterol at unhealthy levels and high blood pressure in children. So all of this is of immediate concern. There's also some issues related to mental health and mental wellness to be a concern for children who are overweight and obese. And the greatest concern overall is that these children are much more likely to remain overweight or become obese into adulthood. And the longer that you are obese or overweight, the greater the health risks. So these children, even if they get through childhood without developing diabetes, they're still at greater risk for diabetes into adulthood. We worry about heart disease related to that blood pressure and cholesterol. So all of those things are of concern, and other things that you would expect. So we see trouble with bone and joint pain. The child's developing, and if they're carrying more weight than what we think is healthy, it can impact joint health and bone health.
So there are a lot of different factors that can really negatively affect. So in your opinion, what are some things that parents and also the government can do to help reduce childhood obesity?
In terms of the government, there's a lot of programming out there now, and especially in the past decade, it's been a real focus of governmental agencies and also non-governmental agencies that have put funding towards trying to understand this childhood obesity epidemic. And the programming naturally is focused on diet and exercise because the causes of obesity in some ways are simplistic in that it's an energy imbalance. So children are eating too much and they're not expending enough energy. But the causes for why someone has that energy imbalance are complex. So we need programming at all different levels. So government programming that we can think about include the Let's Move campaign by the First Lady Michelle Obama, focuses mainly on physical activity, getting children active, also on healthy eating through small farming initiatives. So we see a lot of that going on, getting children involved in growing food and understanding where our food comes from. There's also the national programs that work to get meals to lower income children. And lower income children are at higher risk for obesity, so we're always thinking about them and how to help them. So there's the what was formerly called the food stamp program, now called SNAP, the Supplemental Nutrition Assistance Program. So SNAP offers monies to families who meet certain income criteria, and families can then go out and buy foods to help nourish their family. So along with SNAP, we're also seeing an increase in SNAP education, so offering educational programs for SNAP recipients. There's also a number of programs out there just to monitor obesity. So an important role of the government is to understand the trends. So without our surveillance systems that we have from our public health authorities, we wouldn't know that childhood obesity is an issue, and we wouldn't know where we are in the epidemic. So that's an important role that the government is playing. Now, parents have a great role in childhood obesity because even if your child is school aged and you're working and you feel like you're not that influential on a child's life, that they're eating lunch at school, your child really does look to you for that modeling and that information. So even though they're not with you all the time, the choices that they make are reflective of what you've taught them. So if parents can begin to acknowledge that role and realize that it is challenging because our food environment is essentially greatly promoting foods that cause obesity or that are too energy dense and that aren't nutritious, and they don't emphasize enough the foods that are healthy for us and help us remain at a normal weight. So parents need to acknowledge the challenge they're up against, and then also think about little things that they can do to hopefully impact their child's choices. So we like to focus on the big issues in terms of diet, which are SSBs, so sugar sweetened beverages.
Okay.
So sugar sweetened beverages are any kind of juice drinks, soft drinks like sodas that use sugar to sweeten them and are very calorically dense. So they're full of calories and they essentially offer no nutritional value. So we all know that a can of soda is not providing us any nutrition, and it is providing us quite a bit of calories. So trying to avoid them as much as possible and encourage water for your child as a beverage is a really simple step that you can take, and then hopefully they'll go out in the world and start to make those choices for themselves. We also always like to emphasize fruit and vegetable intake. So fruits and vegetables are important because they help us feel full, and on top of that they have low calories and a lot of nutrition. So the more we can incorporate fruits and vegetables maybe into snack time and also into our well-balanced meals, that is very important. And then the other issue of getting that energy out. So we all know that children have have less opportunities today to be physically active than maybe we remember in our childhood or even further back to our parents' childhood. So we live in an environment where driving is more common than walking, and being physically active has to be sort of a choice. So parents have to figure out how they can make that choice easier for their child. So creating opportunities for fun physical activity that children will want to engage in, and will also reduce their screen time. So it's not just about getting physical activity up, but it's also getting inactivity down. So we're finding kids are spending a lot of time in front of screens, whether it's TVs, iPads, computers, video games. And the more your child's spending time in front of a screen, the less likely they're being active during that time, and it takes time away from that overall physical activity. So helping children get away from the screen and getting into fun, exciting, engaging physical activity is an important thing that parents can do. And the biggest thing that we want to focus on with parents is being a role model. So in our society in the U.S., we've become accustomed to a lifestyle where we might indulge and then diet, indulge and then diet. And children really pick up on this. So the more that you can illustrate that eating healthy and being physically active is a lifestyle, and it's a lifestyle that's rewarding in terms of health and the way you feel, the more that your children will buy into that and really want to engage in that.
Do you think that there's enough physical activity in schools today?
Well, schools are often a focus of discussion when we talk about childhood obesity, but in a lot of ways, schools don't have a lot of options in terms of offering more physical activity and or offering a healthier lunch. So it seems like a great idea to improve the school lunch program, and they've made some revisions in the past few years to try to increase whole grain consumption during school meals and increase vegetable consumption, especially outside of white potatoes. So white potatoes were the most common vegetable across the country being eaten at school lunch, and it's just not a very vitamin-rich vegetable. So while we acknowledge this and the school lunch program is making small revisions, we also have to acknowledge that schools are only reimbursed less than $3 for each meal. And if you imagine yourself, if I gave you $3, would you be able to provide yourself a very nutritious meal? So, so schools are challenged. I think they can work as a community to see ways to enhance school lunch. So what some communities have done is work together, either to get a grant or just fundraising some money to get something like a salad bar started in their school and having that be a part of the school lunch. So because of the regulations of the school lunch program, communities have to realize that anything that they want changed, they might have to really start that themselves. And they can always add things to the school lunch, like a salad bar, like a fruit bar, and children will be excited and interested in that. So I think school communities can do things, but in terms of changing school policies, it's complicated. We don't want to lose focus on what the purpose is of our public school system and the focus on education. But I think physical activity is an important component. Recess is definitely an important component to school achievement. So I think the more we can ensure that our children are getting a recess, especially our young children, during the school day, that's very important. And also making sure that they're getting physical activity. It would be great if that happened every day, but in most schools that's happening once a week. And being active for 60 minutes once a week won't begin to address childhood obesity, but perhaps schools could engage children in physical activity outside of the school day.
Okay, great. So the bottom line, I guess, is get your kids away from the screens and outside and more active. I've seen that a lot from my two nephews.
Yes.
They're Kindles all the time, but
Yes.
it's very different today.
Yes, acknowledging the changes that have taken place that affect, even adults spending time in front of a screen and figuring out how we can limit screen time, get physically active, and provide a really nourishing food environment for our children in our homes, and then hopefully they go out and seek out the healthiest options they can get when they're outside of the home.
Great. Well, I appreciate you speaking with me today. Okay, great. Thank you very much for meeting with me today. And this was Health and Wellness, and I'm Erica Brooke, and we will see you next time.